This is All Things Cancer, the podcast of the National Foundation for Cancer Research, hosted by NFCR's President and CEO, Dr. Sujuan Ba. Dr. Ba is a globally recognized cancer research advocate and visionary leader. All Things Cancer episodes will explore the hindsight, insights, and foresight of cancer, from research discoveries to patient care advances, and how NFCR and our collaborators are working to accelerate the process of making cures possible.
Welcome to All Things Cancer. I'm Dr. Sujuan Ba. Today, I have the honor of speaking with Dr. Witz, a true pioneer in cancer research and the 2023 recipient of the Szent-Györgyi Prize for Progress in Cancer Research. Dr. Witz was among the very first to recognize the critical role of the tumor microenvironment, long before it became a central focus in the field. His discoveries helped shift how the world approaches cancer treatment, from a narrow focus on tumor cells to a broader understanding of the cancer ecosystem. In our conversation, you will hear how he followed his curiosity despite skepticism, why patient-centered science is so important, and what he envisions for the future of cancer research. Let's dive in. Dr. Witz, thank you so much for being here with me today. Your research has had such a profound impact on the field of tumor microenvironment. So to start us off, I'd love for you to share a bit about your view on the tumor microenvironment and what inspired you to explore the area and focus your research on tumor microenvironment.
Well, I had the focus on tumor microenvironment started while I was still a postdoc. I heard a lecture about somebody who saw that the immune response against kidneys in a disease called glomerulonephritis is actually happening not in the blood, but on the kidneys itself. And this gave me, and this was in 1967, the idea of looking at the immune response not in the blood, but at the tumor site. So this was the beginning. And I really found immune responses against tumor cells, against cancer cells, on the tumor cell itself. So this is the tumor microenvironment, which all the cells and molecules that are neighbors of cancer cells. This actually is called the tumor microenvironment.
This is such a fascinating origin story to take on observation in kidney disease and reimagine it in the context of cancer. So at that time, this must have been a bold path, and I bet many saw it as unconventional. So what made you confident enough to pursue it?
Well, at that time, I didn't have very big thoughts. What led me actually is new findings. I personally am not shy of results which are not common and so on. At the time, it was rather difficult. At the time, the cancer cells were the center. Everybody thought that if you would hurt the cancer cells, either by surgery mostly, or by various types of therapy, actually nobody realized that around the cancer cells are actually patients. And a lot of normally operating systems that truly interact with these cancer cells or react to the existence of cancer cells. So I thought this would be a good area to investigate. And I was quite alone at this time. I heard at least twice the term epiphenomenon. Epiphenomenon means a phenomenon which is not important or unimportant. So there were scientists who characterized this research as non-important or epiphenomenon.
I truly admire that kind of courage. We all know science often advances when some people are willing to follow evidence even when the majority of the field are not ready to see it. And I'm going to ask you another aspect of this. So you mentioned patients earlier, and the NFCR always emphasizes patient impact. So could you tell me why is that so important that we keep patients front and center in cancer research, and what does the tumor microenvironment mean for patients?
I think patients should be aware that therapy modalities should not be restricted to destroying cancer cells in any way, but they have to take in consideration that there are constituents of the body, that's called environment and microenvironment, that react. And many of these reactions actually do help the cancer cells to survive and proliferate. So it is very important for the patients to realize that the science now is really geared towards development of therapy modalities that are directed not against cancer cells, but against normal in quotes unquote, constituents of the body that in fact help and assist and promote cancer development and cancer progression towards metastases. And metastases, over 90% of cancer patients die of metastases. It is very important and very complicated, very complicated, to design therapies that are directed against body constituents.
That's such an important reminder. It's not only about killing cancer cells, it's also about understanding the environment that allows cancer cells to survive. And the NFCR has been proud to support research in this field, exploring these kind of connections. Can you share how your discoveries have helped shift cancer treatment in this direction in the past several decades?
Well, I'm not going to be shy, and I'm not going to be modest in this answer. But I think that our research really helped to shift the focus from the cancer cells to all the cells and molecules that are around or in the interface of cancer and the body, and that do assist the cancer cells to progress, or as for instance, two of your laureates, Steve Rosenberg and Allison, use actually and block the cancer promoting factors in the environment. And Steve Rosenberg does to really assist the immune system to fight cancer cells by selecting those immune responses that really won against the cancer cells. So we want to promote the activities of the normal cells that resist cancer development and suppress those activities of the so-called, quotes unquote, normal cells that promote cancer.
That shift from targeting only the tumor to targeting tumor's environment has really changed how cancer is treated now. So you helped move the field from a reductionist view to what we might now call it holistic view. So how did that transition take shape for you?
This is a very interesting question. You know, holistic, the word holistic, up to few years ago, was a dirty word. People thought, things that have nothing to do with medicine. And scientists really disliked or even ridiculed a little bit the word holistic. And it is very interesting that now is a movement to have a holistic look at what I call now the cancer ecosystem. When I saw a recent editorial of a very famous cancer journal, about the need for holistic views. And again, I'm not going to be shy, and I already preached for that in 2006 in a written article.
I love that. You were ahead of your time, Dr. Witz. So today we hear so much about the cancer ecosystem, but you were calling for that perspective nearly 2 decades ago. And with so many changes happening in tumors at once, how do you think researchers can keep up with such complexity?
Well, you see, so many things happen at the same time. I don't know if you know the saying that was attributed to Heraclitus 2,500 years ago, that you cannot step into the same river twice because fresh waters are ever flowing. This is exactly what happens with the cancer. The cancer of today is not the same as the cancer in a month, and people don't realize it. So many things happen at the same time. At the same time, everything doesn't stay stable, and many of our data are actually based on a still photo, not on a video. And if you have now all these things that have to be integrated, I don't dare to say the word artificial intelligence, maybe this would be the answer, because the whole thing is to integrate all those findings that cannot be simply integrated into an holistic approach.
Well, that image of never stepping in the same river twice is so powerful. It really underscores how dynamic a cancer is. So you mentioned the integration, which naturally brings us to collaboration. So how has collaboration advanced your work?
Very much. For instance, we found that a certain molecule that is released from, in one case, from kidney cells, another case from brain cells, a normal molecule can react against cancer cells, can kill them. The big thing was to isolate and characterize these molecules, maybe for therapy purposes. So I started to collaborate with a protein chemist that helped us to characterize these molecules and isolate them, bring them to the next level of development of new drugs. I also collaborated quite a few with people in, of course, in the States, in France, in Austria, in Germany, maybe also Belgium even.
This scope of collaboration you are talking about is inspiring. And it's a part of why we are so proud to honor you with the Szent-Györgyi Prize for progress in cancer research. And what did that recognition mean to you personally, Dr. Witz?
In a very few words, a fulfillment of one of my greatest wishes.
That's beautiful to hear. Thank you.
The problem of my science was that it started when most of the researchers today were not even born. And people look at discoveries that were made 10, 20, maybe 30 years ago. So when the full realization that microenvironment is important came only about 20 years ago. Yet my research, or the biggest discoveries, were made before that. I got prizes, I got lifetime achievement awards and so on. But a prize for the magnitude was actually the first really important public recognition of my contributions.
The recognition for your contribution is so well deserved. Your work truly laid the foundation decades before many others caught up. So, Dr. Witz, now looking back, what are you most proud of in your career?
Well, quite a few things, but mainly the things that were unpopular. First of all, that the immune system works inside tumors, inside the cancer tissue. I think this is the most important contribution of mine. Then unknown molecules, like we have found out, for instance, hemoglobin, the protein all of you know, has parts of it, some chains of hemoglobin, act against cancer cells. This is a finding that nobody knows. And again, I like those findings, so I'm very proud of that. In general, I hate general statements in cancer. I hate them. And I don't know if you ever heard of two sayings that the most dangerous thing is to generalize, including this statement. But let me generalize here that what makes me very happy is things that I discovered that nobody knew before.
Those are truly groundbreaking contributions. And I love how you highlight the joy of discovering something that nobody knew before. And how do you see this knowledge being applied in the future?
As I told you, I don't know anything about artificial intelligence. But no single lab could ever integrate all those thousands of different findings. And what need to be done is to integrate. I call those orphan results. You know what orphan results is? These are all those results that are published in low-impact journals. Journals that nobody of a certain level and above looks at. I've done a little research of 5 papers that have been published in a relatively low impact, not the lowest, but low impact journal. And after 3 years, 5 papers, none of them was cited. These are thousands of that kind of papers. If only 20% of those papers are meaningful and true, they are lost. And we need some mechanism that would integrate all those. So I think here we need an international collaboration that would seek some mechanism of integration of all these things that I was talking about. I think for a general, and I hate generalities, for a general solution of cancer, maybe artificial intelligence would be, but there are huge advances in certain types of cancer. For instance, breast cancer. Huge advancements. Childhood leukemia. I remember I was in my postdoc, I was trained in an institute where children with leukemia, most of them died. Now, most of them are cured. So this is amazing advancement. But if you look of a general answer to the cancer problem, this would only come, in my view, out of holistic approach. And how to realize an holistic approach?
This is so insightful. The idea of orphan result really resonates. Valuable knowledge being overlooked simply because of where it's published. I think your call for integration and perhaps AI-driven approaches is going to shape the future of research. And with that in mind, what advice would you give to young cancer researchers today?
Well, what is important I think the importance of every good scientist to make a new, valuable, repeatable discoveries for the benefit of biomedicine, and especially to translate those findings into the clinic. So I would say that this is what we all aim for and hope to succeed.
That's excellent advice. At NFCR, we work with so many promising young researchers, and your words will mean a lot to them. Let me close by asking one more question. What is your vision for the future of cancer treatment?
To be honest, as a basic scientist, I can only give you some general answer. To boost all the reactivities of the cancer microenvironment that are of anti-cancer nature, and to block all those reactivities of the cancer microenvironment that promote a cancer development or cancer progression.
That's such an inspiring vision, Dr. Witz. We are so honored to recognize scientists like you who are shaping the future of cancer research. And I thank you for sitting down with me and sharing your story with us. It's wonderful. Thank you.
Thank you for listening to this episode of All Things Cancer. Be sure to subscribe so you never miss future conversations. To learn more about how the National Foundation for Cancer Research is working with the global research community to make cures possible, visit NFCR.org. You can also reach us directly at 800-321-CURE.